Do you have anxiety? In fact, do you have so much anxiety that even your anxiety has anxiety? And your anxiety's anxiety has pets, some of which probably belong in a horror movie franchise. Well, don't worry, because in this video, I will be delving into some of the least understood and least known aspects of this most common mental illness in the world today, as well as novel ways to get it under your control. I'm Dr. Alistair Taylor, a licensed clinical psychologist. The first thing you should know about having anxiety is that it does not make you a weak person. Anxiety is a natural response to threat, and in the sense of an ongoing mood disorder, it is likely a learned experience. The sooner the wheels are set in motion, that is, being exposed to a lot of uncertainty in childhood, the deeper the roots penetrate, and the more likely it is that you will be vulnerable to anxiety. If an adult tells you that they don't get anxious the way you do and that you're just being neurotic and just need to get over it, besides being unhelpful, it's a grossly oversimplified understanding of what anxiety is and how it develops. Furthermore, if a guy is criticizing a girl for being neurotic, bear in mind that anxiety disorders are about 70 to 80% more prevalent in females, and there are some valid reasons for that. Having said that, anxiety does respond well to the right treatment, and there are ways for you to conquer it. Firstly, the seeds of anxiety are often sown in childhood. Adults who claim not to feel anxious were likely either the beneficiaries of a stable childhood, at least one loving and protective caregiver, and/or protective genetic factors. Also, adults who claim that they just toughen up and deal with it, even when they are legitimately tough and resilient, overlook one key factor. Throughout the earliest years of life, we are all completely vulnerable, defenseless, and dependent on the care of others. While obvious factors like abuse can be terrifying for young children, more subtle cues can also be very destabilizing for children exposed to them. These might include things like parents fighting intensely in front of their kids, or even just parents that are consistently inattentive due to their own stress-related issues. Little kids don't have the cognitive maturity to understand that mom and dad seem to be ignoring me or giving snappy responses to my questions because they are both under work, marital, or financial stress. They just feel ignored and may internalize this as worry, an anxiety that they aren't important enough to have their parents' attention and affection. This is probably not so much a thought process as a felt emotion. This is what I mean when I refer to planting the seeds of anxiety, because the emotions begin to guide thinking, which would likely be modeled somewhere along the lines of, I can tell that things are wrong, and it feels like they're going to keep going wrong, and I don't know how to stop it. The helpless feeling is a key feature of anxiety, because if you feel you can fix a problem, it's not really a problem or worth worrying about. And just to quickly add in some related causes of anxiety in children, I think we can all tell when another person is anxious, right? They don't have to say anything. The nonverbals usually speak volumes. If a child is often around an anxious parent, they can pick up on this through emotional contagion, partly because children are less able to balance emotion with reason. The ability to reason is still years away from being developed. Also, caring but anxious parents tend to overprotect their kids because they worry they'll get hurt. So these kids implicitly learn that everything is dangerous, they aren't strong or capable enough to deal with things, and don't learn that they can bounce back from being hurt by taking small risks. These are ultimately a potential model for how they approach life. Avoid, and avoid some more. And then the last thing I'd say about factors we have no control over is pregnancy itself. If the mother is having a stressful pregnancy, for example, not feeling safe, loved by her husband, or secure about her future, she will likely have chronically high levels of circulating stress hormones, such as cortisol and adrenaline. Because these hormones cross the placenta, they can affect the developing baby in the brain. So these infants are basically primed for stress or anxiety before they are even born. Clearly, these are issues that are well beyond our control if they happened when we had no control over them. There are a myriad of factors that can contribute to our vulnerabilities to anxiety, and that should at least give us reason to be patient with both ourselves and others if they seem overly anxious. There are also medical issues that can bring on symptoms of anxiety and which may not be psychological at all. These include hyper or hypothyroidism, low blood sugar, asthma, anemia, and cardiovascular problems. These, however, all relate to dietary and lifestyle issues, which are also linked to anxiety, so it's something of a circular equation. So there are primarily two approaches for treating anxiety, which are psychotherapy and medication-based interventions, although the latter one could also refer to biologically mediated changes such as diet and supplements. These approaches can be used separately or together. Similarly, there are psychological or experiential life events such as what happens to you and what or how that affects your way of thinking, or biological factors that contribute to the onset of anxiety. Anxiety may stem from either or both of these factors. To briefly define it, anxiety is a fear-based response to threat, which is natural, but unlike fear itself, does not readily resolve when the threat is past. It tends to linger and tends to overestimate the threat and underestimate your ability to deal with it, and often creates a sense of powerlessness to do anything about the problem. Threats can be quite specific, such as the fear you might lose your job because the company has recently been downsizing, or non-specific, such as a general sense of foreboding that things won't go well for you this year. Anxiety is often accompanied by unpleasant physical symptoms, such as irritability, difficulty concentrating, muscle tension, and poor sleep. There are too many effective therapy approaches to list here, but I'll go over a couple of them. One is just by virtue of being listened to without being judged, you can ease some of the physical and psychological tension inherent in anxiety, especially if not feeling heard and feeling judged are part of where your anxiety stems from. Secondly, developing a firm understanding of anxiety and its origins help uncouple the idea that your anxiety is a symptom of your weakness, that is, a personal flaw, and teaches the idea that anxiety is likely a product of factors beyond your control, for example, genetic and environmental factors that affect people in similar ways. This knowledge can also be empowering. And if you want proof of the influences of genes, just look at the studies of identical twins who have the same DNA, but who are raised apart as in the case of adoptions. Even in very different environments and cultures, if one twin is anxious, the other is likely to be anxious too, independent of parental influence. Thirdly, you will learn that anxiety can be controlled even if you can't control the circumstances that cause it. In other words, you learn to think and behave in a way that shifts the locus of control from the environment, which is essentially uncontrollable anyway, to within yourself, which takes some work but definitely can be mastered. Since emotions can be very powerful and overwhelming, cognitive approaches are somewhat limited in treating anxiety, although they are still used. The main focus in therapy is repeatedly exposing yourself to anxiety-inducing situations in a graded manner, typically starting with low levels of fear and working your way up. In summary, this process includes developing an understanding of where anxiety comes from and placing it in your life's context, some cognitive reframing and restructuring of thoughts and beliefs about yourself and anxiety, developing skills to tolerate negative emotion and enhance relaxation even when stressed, setting specific targets to undo the anxious response in practical real-world experiences, and then going into the practice of exposing yourself intentionally to anxiety-inducing situations. In this process, you're dealing with anxiety at the level of emotion, not just cognition. Exposing the mind to fear on purpose automatically involves some level of control, as the default position is that the feared thing just happens to you and you react with fear behaviors. But in this case, you are in the driver's seat. Along with the coping skills, a new understanding of anxiety, and a little bit about yourself and others, and hopefully with the added benefit of a strong alliance with your therapist, you begin to immerse yourself into the feelings of anxiety, but now learn how to tolerate it and stay with it rather than running from it. You learn to accept emotions for what they are, just feelings and not always an accurate representation of reality. After a while, perhaps 20 minutes or so, anxiety usually peaks and begins to settle. This is also the natural wave of emotional experiences, but it is sometimes blocked by us going to war with the feelings rather than letting them pass like a wave, as in an acceptance approach. Eventually you learn a few things. Anxiety can be tolerated. The emotions don't kill you. They go away in time without doing anything, and that having the anxious thoughts and feelings doesn't cause the feared event to happen, and you are stronger than you thought you were. As the brain develops adaptations and realizes that fear is often more imaginary than real, it starts to let go of that anxiety, and your confidence in yourself builds. Since lengthy books are written on this topic, there is a lot of nuance I'm leaving out, but for the sake of simplicity, this is how you rewire your brain to handle anxiety quite differently. Regarding the biology of anxiety, I first want to state that I'm not prescribing anything here, just offering some basic information that you can discuss personally with a healthcare provider or educate yourself further on, because these topics are extremely complex, very extensive, and they're definitely not a one-size-fits-all approach. That said, the following points either have a strong evidence base, or at least it would be helpful for you to know a bit more about them. So, the brain contains an estimated 100 or so types of neurotransmitters, although only about 10 types are very well studied. These are the chemical messengers that are released when a brain cell or neuron fires, and act as signals for surrounding neurons to either fire or do nothing. In neuroscience terminology, these states refer to excitatory or inhibitory neurotransmitters. The two main neurotransmitters implicated in anxiety are glutamate, which is excitatory, and GABA, or gamma-aminobutyric acid, which is inhibitory. GABA is the target of anxiety-relieving medications and is also associated with rest and relaxation. Glutamate is not a bad neurotransmitter, as it is essential to learning and memory, but too much of it is a big problem. It is also quite strongly associated with seizure disorder and schizophrenia, amongst a few other disorders. Serotonin, which is the neurotransmitter most associated with depression, is also implicated in anxiety, which is not surprising given the high comorbidity of anxiety and depression, and is also the target of some medications for anxiety, such as SSRIs, or selective serotonin reuptake inhibitors. My view on and experience with medications is that they certainly help some people, but as MDs often say, medicine is part art and part science. The brain is very complicated, and it can be a trial and error process to get these things right. Moreover, there are often side effects or unwanted side effects associated with polypharmacy, or the use of several medications in the same person for different conditions. Benzodiazepines such as Xanax are one of the most common sedative medications used for anxiety and target the GABA system in the brain. Sedatives, however, can be dangerous for those who also have depression because they can make them feel even more low energy and can increase the risk of suicide. Benzodiazepines are best used for short-term treatment along with therapy that helps the person overcome anxiety rather than simply medicated it forever. These drugs can also lead to addiction, unpleasant withdrawal symptoms, prolong the avoidance of dealing with the causes of anxiety effectively, and cause cross-tolerance with other medications. There are other medication options for anxiety, but the main point I want to make here is that medication is probably neither good nor bad. It's just a question of it being effective for you. The other point is that medications can and do work, which indicates a specific biological target of these drugs, and that if you can target the same systems naturally, you can also pursue that option. If done correctly, there won't be concerns with things like side effects and withdrawals and building up tolerance to the drugs. Conversely, simply injecting adrenaline into the body can cause feelings of intense arousal, anywhere on the spectrum of anger, fear, or euphoria, and whatever it is that you feel is usually context dependent. In other words, whatever the emotional response would have been naturally in that given situation, adrenaline amplifies those feelings. The point here is that anxiety has a clear biological basis, and the environment serves to steer it in certain directions. But ultimately, learning to control what is within you is the determinant of your response to the environment. An interesting example of this is the class of drugs known as beta blockers, which were originally developed to treat abnormal heart rhythms and risk of secondary heart attacks. They have also been used with some success to treat anxiety. The interesting part is that the heart problems would typically be considered medical or physiological problems, and anxiety would be considered psycho-emotional. A closer look suggests that the one can be a driver of the other. Beta blockers are effective against the physical symptoms of anxiety, such as pounding or racing heartbeat, clammy hands, and rapid, shallow breathing, but not anxiety itself. However, by reducing the physical symptoms of anxiety, the emotion also simmers down. This is important because we can see the body as an integrated system rather than a bunch of disparate parts, and leveraging control over one of the physical, emotional, or mental aspects of anxiety can help regulate the others. Thus, you can gain control over your emotions through behaviors, physical changes, and that you can consciously control, and even your thoughts. Granted, emotions can be overwhelmingly powerful, but bear in mind that even those elite level humans who are trained to be unflinching in the face of intense danger, such as the Navy SEALs, are taught to use their breathing to control their heart rate and, by extension, their emotions and their fear response. By the way, this may explain in part how techniques such as meditation or prayer can become effective in reducing anxiety over time. With practice, you learn how to experience your emotions without running from them, how to build up tolerance to them, and how to bring about conscious awareness of how to become and stay relaxed. Similarly, regulating your breathing with more emphasis on the breath out than the breath in can slow the heart rate, communicating to the brain that the perceived threat is diminishing. Each time you breathe out, the heart rate decelerates ever so slightly. So this is not the same as taking big deep breaths when anxious, but rather about bringing breathing to a slow, even rhythm, but with a bit more emphasis on the exhale. Also, by practicing muscle relaxation, you can undo some anxiety symptoms that way. The fight or flight response usually entails muscle contraction for physical action and explains why chronic anxiety can lead to sustained muscle tightness that you perhaps weren't even aware of until you got a massage. By consciously tensioning muscles as tightly as you can for a few seconds and then relaxing, you enhance the sensation of relaxation and bring awareness to the sensation of that tension. Without awareness, the problem is likely to just run in the background, thus physiologically maintaining the sense of anxiety. To loop back to the pharmacology of anxiety, my main point here is that there is an underlying brain chemistry here, and that there are natural ways to intervene aside from medications, which should be used as needed, but not considered a cure for anxiety. This, again, is a vast and complex topic, but as a brief overview, one approach is through the avenue of metabolic psychiatry. This looks at the relationship between metabolic health and mental health. One of the most impactful ways you can shift brain chemistry in a favorable direction is via a prudent ketogenic diet. I emphasize the word prudent because, like almost any diet or four-letter word, it can be misapplied. Theoretically, you could get into a state of ketosis on a diet of bacon and cheese alone, but that wouldn't necessarily be a healthy version of the diet. As to the anxiety itself, by shifting brain energy metabolism from glucose to ketone bodies, there is a corresponding shift in the balance between glutamate and GABA. As you recall, glutamate is the excitatory neurotransmitter strongly associated with not just anxiety, but also seizure disorder, autism, and schizophrenia. GABA is the neurotransmitter associated with a sense of calm and is the target of many anxiolytic drugs, and is derived from glutamate. So the balance between these competing chemicals is of vast importance here. A ketogenic diet can so powerfully alter the ratio between glutamate and GABA that it is an evidence-based treatment for seizures when medications fail. Besides that, a correctly applied keto diet can reverse conditions like type 2 diabetes, reduce chronic inflammation, and dramatically lower the risk for conditions like cardiovascular disease and dementia. Like I said, this topic is too exhaustive to cover here, and you may need to do a lot of self-education or consultation with a dietary expert on how to implement it, but the evidence for a keto approach is quite compelling. There are a few rare instances wherein a keto diet is contraindicated in some folks, so guidance is useful. However, even in these cases, the use of supplemental ketones is something to explore. It also seems likely, just from observation of a few hunter-gatherer tribes worldwide, that a keto eating lifestyle is consistent with how humans have eaten for millennia. In other words, there were likely periods of intermittent fasting wherein insulin levels would be lowered due to low carbohydrate intake, and the body would shift to ketone production to use available fat as a fuel and to conserve what glucose is in the system. Furthermore, the carbohydrates people consumed were nothing like the abundance of processed carbs that we have today. So in general, the entire diet would have reflected low insulin stimulation. Another potential virtue of a keto diet, at least in my view and knowledge of the topic, is that because it is low but not zero carbohydrate, you can still incorporate a decent amount of low glycemic plant foods that have their own health benefits, such as berries, broccoli, and small amounts of things like sweet potato. Carb intake will likely be somewhat related to your activity levels, but remember that keto is not a black and white concept, it is a spectrum. It essentially reliably shifts the dominant source of energy to ketones rather than glucose. The intake of some of these plant foods may also help nourish a healthy gut microbiome, which plays a critical role in mental health and is often grossly dysfunctional on a processed foods diet. And then the last thing I'd like to say about subtly shifting brain chemistry is that some natural herbs available in supermarkets can be helpful. As with the above, if you're on medication, you should consult with your prescriber first, because even though herbs are mild and generally safe, they can definitely interact with some medications and possibly interfere with, inhibit, or overly potentiate some drugs. However, what is interesting to note is that herbs and drugs have similar targets, but the herbs are much milder, and they may confer other benefits and seldom have side effects. Herbs are also less addicting for the same reasons, but because they are milder, the benefits may take a bit longer to show. They may be considered more as part of a healthy lifestyle than a specific treatment per se, but they can definitely have calming effects on the mind and body. One pretty clear example of this is the use of valproic acid, which is used to treat epilepsy, mania, and bipolar disorder, and sometimes in aggression with children with ADHD. Valproic acid is derived from valeric acid, naturally occurring in the valerian plant. Valerian has been used for centuries for conditions like seizures, insomnia, and anxiety. Both valerian and valproic acid work similarly. They help raise levels of GABA in the brain. The difference is that the pharmacological approach is much more concentrated, hence the risk of unpleasant or even dangerous side effects. There are other herbs too that act in a similar manner, such as chamomile. The fact that these herbs don't have the sledgehammer-like impact of pharmaceuticals is probably why many folks might question their effectiveness, but the important thing to remember is treating anxiety is a multifaceted approach, and if you address it at the levels discussed in this video, that is more holistically than just taking medication or only going to therapy, you may reap significant gains over time. And the last thing I would say is that exercise has been shown to be an effective treatment for anxiety too. If you have any questions about what I've shared here or would like me to elaborate on any of these topics, please leave a comment below and I can do a follow-up video. All right, thanks for watching.